Welcome, everyone. Thank you for joining us this afternoon. This is the Hemophilia Council of California's Advocacy and Public Policy webinar, Choose Smart, Don't Be Overwhelmed by Your Healthcare Choices.
So for those of us who have employer plans or choose kind of from a private insurance company, again, there are a bunch of ABC acronyms that are important to understand. So we put those together in the Choose Smart plan so that you really can look at the elements of how to choose a plan, like what types of plans, the metal levels. You can blame Congress for naming them the metals, but they actually work pretty well, and the cost of care. So I'm going to start with these one. What's an HMO? I think most of us know. An HMO is a health maintenance organization. And so it controls kind of the physicians you see, the services you get. A true HMO is like a Kaiser. You go in, that's a closed model, but you go in and it's a full service wraparound. They take care of things. You don't get to see out of network providers, and out of network costs can be a challenge. We've seen a lot of news stories in the last year or two about surprise medical bills, and those are out of coverage. Like if someone goes to a hospital because of their car accident, but it's not in their network. If I drive down to San Diego and I get in a car accident, I'm going to end up in a, San Diego hospital. So there are challenges with that if someone moves all the time, that's out of network, and you could get billed the entire cost. Again, I keep going back to Congress is working on that, and hopefully between California lawmakers and the federal folks, they're working to ban kind of those surprise medical bills and try and create a system so the patient doesn't accidentally, without any intention, kind of end up paying the full price for something. Most people in California, I would say, use an HMO because it's the easiest. And it seems the least expensive if you don't need a lot of expensive care. The next is the PPO, or the Preferred Provider Organization. Individuals with chronic disease needs, and I would say probably people with bleeding disorders, need to see certain specialists. And so a PPO, while maybe a little more expensive, allows that you to direct your own healthcare. And so a broader network of providers, but you do pay for that. And there are times in your lifespan that might make sense. When you're young and healthy, an HMO is, probably just fine. When you get older and you have certain needs and need to see specialists, the PPO may be something to look at. And then a point of service option is kind of a hybrid between an HMO and a PPO. It's a type of managed care plan that has a designated network, but offers some flexibility in seeking care outside that network. Again, you may need a physician referral to get outside the network, and you may have to pay a little more out of pocket for your care. So the second choice that you need to look at as you think through that then is the metal levels. And there's been quite a bit of discussion in California because people would choose in the bronze plans because they were the least expensive, but then they'd get hit at the pharmacy counter, or they, get these surprised, like, why did my medicine go from a $25 copay to now I'm paying $500? So the bronze plans are the lowest monthly premium, but the highest costs when you need care. And you'll have to pay for most of the routine care yourself. So I hear from people all the time saying, why did I even bother to get it? I feel like I'm paying out of pocket for it all the time, because it really is there when you need it. But that's the lowest cost on the metal plans. Most experts would say people should look at the silver and higher as they're choosing their health plan if they can afford it. The silver offers a moderate monthly premium and moderate cost when you need care. The option may work better if you're willing to pay a slightly higher monthly premium to have more of routine care and covered. And then gold is a higher monthly premium, but lower cost when you need care. If you require frequent healthcare, this option could be the best. And then the platinum is the highest monthly premium, but the lowest cost when you need care. And it also has the lowest deductibles, meaning your plan starts paying its share earlier than the other categories. So if you use a lot of care, that might work out best. And you almost have to use, and thank goodness the Covered California website provides a tool so that you can really look at this and start, managing, like, how often do I go to the doctor? What services do I need? What medicines do I need to really choose the right plan? because the cost of your care, once you've chosen all of those things, you know, you have to consider the other costs besides your monthly premium, which is the deductible. And this year we saw quite a bit of legislation in Sacramento at the Capitol trying to lower the deductibles that patients had to pay. You know, there was probably like 10 pieces of legislation, including, you know, one that would exempt medicines from your deductible so that you just pay the copay for the medicines and you wouldn't have to spend up to your deductible before your insurance would kick in. A goal always is to try and make sure that people, you know, people can get their medicines and people can get access to care. And they're always kind of fighting the insurance industry, saying we're trying to keep premiums down and cost is expensive. So it's a kind of a push and pull all the time. So the deductible, remember, is the amount you pay for health services before your insurance starts to pay. The co-payment is a fee you pay each time you go to the doctor or to fill a prescription. And out-of-pocket maximum that people don't always think about too is the most you'll ever have to pay for health services. And once you hit that amount, your healthcare is covered. Those that are in the meeting today, you want to jot down the CaliforniaChronicCare.org website and the MyPatient rights, and also Covered California has a website. They're really good places to go because there's a lot of information I've kind of used like a fire hose to give you today. And I wanted to make sure I got through most of it at the beginning so I could answer any questions people have. But there, you know, everybody should know that purchasing health insurance is complicated. There are many organizations that have been created really to help people choose the right health plan. Everyone wants everyone to stay as healthy as possible, including the health insurers, because remember, you're a lot cheaper if you're healthy for a health insurer. And so it's really a matter of taking a fairly complicated system because we all have very individual needs and making sure that the system works for you.
We thank Kassy again for joining us for this great information. We will put the links on our website along with the video when we have it completed. And we really appreciate everyone joining us today. Thanks so much. Well, we will see you next month.
Thank you, Lynn.
Thanks. Bye-bye.